Diabetes is a common condition that affects people of all ages. It happens when your blood sugar or glucose is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Most forms of diabetes are chronic or lifelong, and all forms are manageable with medications and lifestyle changes. There are several forms of diabetes. Type 2 is the most common. Your blood carries glucose to all your body's cells to use for energy. When glucose is in your bloodstream, it needs help, a key, to reach its final destination. This key is insulin, a hormone. If your pancreas isn't making enough insulin or your body isn't using it properly, glucose builds up in your bloodstream, causing high blood sugar or hyperglycemia. About 537 million adults across the world have diabetes. Experts predict this number will rise to 643 million by 2030 and 783 million by 2045. Symptoms of diabetes include increased thirst, also known as polydipsia, and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in your hands or feet, slow healing sores or cuts, frequent skin and or vaginal yeast infections. Too much glucose circulating in your bloodstream causes diabetes, regardless of the type. However, the reason why your blood glucose levels are high differs depending on the type of diabetes. Causes of diabetes include insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when cells in your muscles, fat, and liver don't respond as they should to insulin. Several factors and conditions contribute to varying degrees of insulin resistance, including obesity, lack of physical activity, diet, hormonal imbalances, genetics, and certain medications. Type 1 diabetes and LADA happen when your immune system attacks the insulin-producing cells in your pancreas. During pregnancy, the placenta releases hormones that cause insulin resistance. You may develop gestational diabetes if your pancreas can't produce enough insulin to overcome the insulin resistance. Other hormone-related conditions like acromegaly and Cushing syndrome can also cause type 2 diabetes. Physical damage to your pancreas, from a condition, surgery, or injury, can impact its ability to make insulin, resulting in type 3C diabetes. Certain genetic mutations can cause MODY and neonatal diabetes. Blood glucose levels that remain high for too long can damage your body's tissues and organs. This is mainly due to damage to your blood vessels and nerves, which support your body's tissues. Cardiovascular or heart and blood vessel issues are the most common type of long-term diabetes complication. They include coronary artery disease, heart attack, stroke, and atherosclerosis. Other diabetes complications include nerve damage or neuropathy, which can cause numbness, tingling, and/or pain. Nephropathy, which can lead to kidney failure or the need for dialysis or transplant. Retinopathy, which can lead to blindness. Diabetes-related foot conditions, skin infections, amputations. Sexual dysfunction due to nerve and blood vessel damage, such as erectile dysfunction or vaginal dryness. Gastroparesis, hearing loss. Oral health issues such as gum or periodontal disease. You can't prevent autoimmune and genetic forms of diabetes, but there are some steps you can take to lower your risk for developing prediabetes, type 2 diabetes, and gestational diabetes, including eat a healthy diet, such as the Mediterranean diet. Get physically active. Aim for 30 minutes a day at least 5 days a week. Work to achieve a weight that's healthy for you. Manage your stress. Limit alcohol intake. Get adequate sleep, typically 7 to 9 hours, and seek treatment for sleep disorders. Quit smoking. Take medications as directed by your healthcare provider to manage existing risk factors for heart disease. Please like, share, and subscribe to our YouTube channel for more informative content on health and wellness.